Flu infections are on the rise across the country and here at home. According to the CDC, at least 1.8 million people have gotten sick so far this flu season. And of those, 17,000 had to go to the hospital. Dr. Willie Underwood is with the American Medical Association, is joining us via Zoom this morning. Good morning. Thanks for being with us.
Good morning. Thank you for having me.
So as families gather, as we know, for the holidays, flu infections are expected to increase. We see it every year. What can people do to protect themselves and their families from getting sick?
The main thing they can do to protect themselves from getting sick this flu season from the flu is to get vaccinated. Yeah. That will decrease your risk significantly of getting the flu. And if you get the flu, decrease your risk of being hospitalized or dying from the flu.
And it's interesting, Doctor, I feel like we tell people this every year and throughout the year, and particularly this time of year. And so despite that, health workers are still reporting a drop in the number of people who have gotten their flu vaccine. I mean, why do you think that is?
Well, because maybe we're not talking about it enough. Maybe that they don't know that they can go to getmyflushot.org and find information or talk with their healthcare provider and physicians about getting a flu shot, and that is safe, that is effective. Like I said, decrease your risks of getting it by 50%, decrease your risks of getting hospitalized by cutting that in half. And last season, 6 million people didn't get the flu because they got a flu shot. Let's think about that. That's the information that I think people should know.
And I think that there is also, there tends to be when I'm out in the community and we're talking about flu shots, it's usually, well, I could get the flu shot and I could still get the flu. But I think to your point, the important message here is but the flu shot protects you from getting seriously sick, most of the time, which is the important part here. So are there particular groups in our community at a heightened risk this flu season?
Well, everyone's at risk this flu season because the vaccinations have gone down. But those who are infants, young people, who should get a shot? 6 months or older. So young people should get a shot. Our elderly people are at greater risk. We know that African Americans, Native Americans, Alaskan Natives, and Hispanics are at greater risk of being hospitalized from the flu.
And again, I mean, it's not too late to get your, for us, remember, we're in Florida, so we just started getting cold weather. And we know that during cold weather, more people spend time in enclosed circumstances, in which case that's when the flu really, really ramps up. But in general, it's certainly not too late.
No, it's definitely not too late. Matter of fact, we're entering the peak flu season up until February. We're entering the holiday season. Well, we'll be traveling, getting on planes and trains and in automobiles, interacting with people. This is the time to get a flu shot if you haven't had one, to get vaccinated.
There is a misconception that I would love to end our interview on, if you wouldn't mind, Doctor. And again, we hear this a lot. People will say, if I get the flu shot, it means that I'll be given the flu. Could you clear that up, please?
No, you will not be given the flu with the flu shot. And yes, you can get a flu shot and a COVID vaccine at the same time.
Perfect. Two important questions answered. Thank you, Doctor. We appreciate your time this morning.
Thank you very much for having me.
And for more information, by the way, about where you can get a vaccine near you, just go to getmyflushot.org. And of course, don't forget that the city is also helping remind you, if cost for some reason is a factor for you, it should not be when getting the flu shot. While health insurance covers 100% of the cost of a flu shot, those who do not have insurance would have to pay $30 or more out of pocket. But here in Jacksonville, the Flu Vax Jax campaign helps bridge that gap. So if you don't have insurance, you can request a no-cost vaccine voucher. Just look inside this story on news4jax.com so that you can get vaccinated for free.